dear Society for Acupuncture Research Executive Committee, and dear conference guests. Thank you for having me. I am truly grateful and honored to participate in this forum. My name is Gil Tan. I am a Chinese medicine practitioner, researcher, and lecturer from the Graduate Institute of Acupuncture Science in China Medical University in Taiwan. In today's very short extract, I will present a summary of my research publication about the anti-inflammatory effects of acupuncture treatment in osteoarthritis patients and their decreased risk to develop coronary heart disease. So let's start, shall we? Today's presentation is based on previous investigation, which was published ahead of print in July last year in the Journal of Alternative and Complementary Medicine. As well, this paper was accepted for publication in JACM special issue on effectiveness, implementation, and dissemination research in integrative health. Among more than 100 different types of rheumatic diseases, OA is considered to be the most common form of arthritis. In terms of epidemiology and risk factors, OA affects more than 10% of the population. It becomes more common with older age, and women tend to suffer more than men. The most affected joints are the knee, hip, and hand. And in terms of traditional risk factors, excessive weight and joint stress or overuse, and as well past injury or surgery may affect the affected joints. However, in the next slide, we will talk about recent understanding about the pathogenesis of OA. So pain is the most dominant symptom in this disease, usually accompanying with stiffness and swelling of the affected joint. And as well, some of the patients may experience loss of movement and function, which greatly affect their quality of life. So besides those signs and symptoms, OA is also associated with other comorbidities like depression and disturbed sleep. And it is a leading cause of disability worldwide and a major cause of healthcare expenditure. So as you can see in this figure, in 2009 in the US, the annual expenditure for OA disease was $29.5 billion. That's a lot of money. In terms of OA pathogenesis, traditionally, OA was associated to cartilage destruction, which in some degree involves abnormal mechanics. So the term osteoarthritis, where it is indicated for inflammatory process, is indeed correct. However, is it as a result of the wear and tear process, or does the inflammation promote the destruction of the joints? So for a long time, OA was considered as a non-inflammatory disease that was the result of this wear and tear process. And therefore, OA was often misnamed as a degenerative joint disease. However, OA pathogenesis is much more complex than that. And in the last decade, more research has been done about the role of vascular alternation, which may promote inflammation and lead to this joint disease. In recent years, there are more studies that show the association between atherosclerosis and osteoarthritis. And even more than that, there are publications that show the association between OA and the risk of cardiovascular diseases. This is one example of meta-analysis of observational studies. So OA and AS share a common ground. For one hand, OA has this joint biomechanics risk factor, while on the other hand, AS has smoking. However, in the middle, many risk factors are associated to both of the diseases, which include age, sex, obesity, vascular dysfunction, inflammation, and more specifically, the metabolic syndrome. So what acupuncture can offer for these diseases? In 2003, the World Health Organization has published a report on acupuncture clinical trials and support the use of it in many diseases and medical conditions in which pain was involved. So there is evidence to support the use of acupuncture in OA patients and the reduction of pain intensity, and as well for the improvement in functional mobility and health-related quality of life. However, what we don't know is whether acupuncture can prevent CHD events from occurring. So therefore, our hypothesis was that acupuncture treatment might have a beneficial effect in OA patients in reducing the risk to develop CHD. Therefore, we use Taiwan National Health Insurance databases to answer this research question. So this is a nationwide retrospective cohort study. We include patients older than 18 years old with at least 2 ambulatory visits or 1 hospitalization with OA diagnosis. And we exclude patients who are younger than 18 years old or having missing information for age and sex or had previous diagnosis of coronary heart disease before the initial diagnosis date of osteoarthritis, okay? So in our study, we had 3 cohorts. The first cohort is osteoarthritis patients with acupuncture use. The second cohort is osteoarthritis patients without any acupuncture use. And the last cohort were non-osteoarthritis patients without any acupuncture use. Okay, so this cohort is basically the general population that we want to compare the incidence of CHD with or without osteoarthritis. All subjects were followed up for more than 10 years or until the first incident of CHD diagnosis, which was the study primary outcome. We one-to-one match all cohorts and analyze a total of 5,046 patients, 1,682 in each cohort. So this is table 1, and as you can see, there were no significant between group differences in sex and age distribution, urbanization level, and monthly income. And as well, we included many comorbidities and medications at baseline. The results were very interesting. First, OA cohort without acupuncture had a significantly higher overall risk of CHD compared to non-acupuncture cohort. And second, OA cohort with acupuncture treatment had significantly lower risk of CHD compared to both cohorts. In terms of medical expenditure, our data suggests that OA acupuncture cohort was significantly less costly to take care for. In terms of the subgroup analysis of OA cohorts, patients who used both acupuncture and oral steroids were at significantly lower risk of CHD compared with patients who used neither. And patients who used both acupuncture and NSAIDs had 3 times lower incident rate compared with patients who used only NSAIDs. However, the results were not significant. Based on the findings of this study, it appears that acupuncture may reduce the incidence of CHD by improving non-risk factors for it or by exerting anti-inflammatory properties. The present study had several limitations, as you can see in this table, which arise from the nature of the retrospective analysis and characteristics of the database. However, our conclusion is very positive, and this study offers valuable insight into the protective effect of acupuncture in CHD prevention, and future prospective clinical trials comparing the effect of acupuncture treatment on OA patients and their risk to develop CHD are needed. And last, before I finish, it is important to acknowledge the following professors for their contribution. Thank you for your attention. I hope to see you next time in person in SARS future conferences.